Hi, my name is Ben Garland. I'm founder and CEO of Onsite Medical. So we founded Onsite Medical to change the way that occupational healthcare operates. The traditional model has an inherent conflict of interest because the clinics make more money when patients stay in the system longer and there's an incentive to provide additional care. However, at the same time, that drives up claim costs for employers who then inherently want their patients out of the system as quickly as possible. This creates a tug of war with the employees stuck in the middle. Our solution to that problem is to remove the financial incentive from the healthcare system so that there is no additional incentive to overtreat, but there's also not a disincentive for employers to give their employees access to the care that they need. Traditionally, job site clinics have been about providing the bare minimum to patients while trying to achieve maximum results. However, in our clinics, because there's no cost for additional care, we're able to implement additional solutions. Tangible examples of that are our mental health solution, Support On Site, or SOS, where we're able to provide on-site mental health care to our patients at the job site clinics, which is something that's never been done before. Our core values really outline the process by which we do that, which are listen to understand, identify and adapt to the need, simplify the solution, hustle and deliver, and execute confidently. And that really outlines how we do everything, from our sales process to how we treat our staff internally, to our customer service process, and most importantly, our patient care model. That's the process that we go through to drive positive outcomes. One of the performance metrics that we're most proud of is our on-site resolution rate, or the percentage of patients that we're able to successfully treat on-site without a financial impact to the employer. Nationwide, we're able to treat 97% of the patients that come in with an occupational healthcare issue. In addition to that, we're also able to treat 91% of patients that come in with a personal medical issue, for a combined U.S. on-site resolution rate of 95%. We provide on-site occupational healthcare clinics to large blue-chip employers across the U.S. We can deploy clinics rapidly anywhere in the United States. We have clinics currently at Pearl Harbor in Hawaii, throughout the Southwest, which is where we're founded, all across the Gulf Coast, and on as far east as Massachusetts and the Eastern Seaboard. One of the people that we're most proud of at our company is Lisa Frieden. Lisa Frieden currently serves as our president and clinical director. However, her story is pretty profound. She actually started as our first on-site nurse provider at the clinic that we're sitting in today for a major blue chip national brand. At the end of the day, the magic of what we do is not necessarily putting Band-Aids on boo-boos. It's about creating a compassionate culture of care that drives trust for the employees that we serve and creates a culture of reporting. So they come to us when they're in need and they trust us to give them a care plan that works. Lisa's natural personality embodies exactly that. And it's her compassion and her approach to patient care that we have built the whole company around, and we try and mimic across all of our providers today.